You've been coming on a regular basis. I'm one of the team members who coordinates this training on a monthly basis. This is our first Friday training. We were having them on the second Wednesday of each month, but by popular demand, we're now having them on the third Friday. So in addition to myself, today we have an additional speaker. Some of you may know because there was a second flyer that went out. For those of you who didn't get it, we have Mr. Albert Perez from Department of Vocational Rehabilitation, and he is the administrator there. He has graciously kind of asked that, I get this started, and then he's going to come up and share the second half. We planned a great training for you. I know one of the problems that we have now, and this is nationwide, is employment. With all the cutbacks, unfortunately, the Department of Vocational Rehabilitation is not able to service clients at the level that they did when I was one of their clients. I also took the liberty to disclose, which I'm not a person who is outspoken about my past, but I thought if it might help somebody that I would share a bit about myself. And I don't know, how many of you received that 180 degrees of success attachment that Ken sent out with the flyer? Any of you? Okay, great. Okay, so you're aware of it. And as I said, it was helped to motivate individuals because it is exactly what I needed during that time, was motivation. I want to talk today about transitioning. Transitioning, when I started, when I first had the idea to do this training, and we decided that we thought a piece that we hadn't talked about in maybe a couple of years was vocational rehabilitation, that I would invite someone out to be a speaker. And as I went around and I tried to get a speaker for this event, I had difficulty finding someone who was available. So at that point, in a conversation with a person over the phone who I was asking to be the speaker, I just said to her, well, I'm a vocational rehabilitation counselor myself. I mean, that is my heart, that is my passion, is what I love doing. As I said in the letter, I'm from New York City, and when I was in New York, I started out, my first career was as a voc rehab counselor. And at the agency where I worked, many of the clients, like myself, had no skills, had little or no education, and there was another word we used back then, and we said habilitation, because we weren't being in treatment or in services to get back what we had lost. It was for people who, for the most part, didn't have anything, very many resources to start with. So I did a lot of work in rehabilitation, but also a lot of work in habilitation. And one of the things that I learned along the way was that it's inspiring when a person knows that someone else has been there, done that, and has the T-shirt, so to speak. And so I inspired a lot of the people who I worked with by doing self-disclosures when I felt that it was appropriate, to let them know that, I had met the challenges and that they could meet the challenges. I just want to say that along the way, it wasn't always a smooth journey. There were lots of bumps in the road. There were people who felt that it was a disadvantage to hire someone with a disability. And so there was that, I guess you could call it discrimination or prejudice or racism that went with trying to get a foothold in in terms of working in this field. But those challenges can be met, and one of the things I want to talk about today is empowering the client. Because had I not been empowered I would not have been able to continue on the road that I was on. I was empowered by people who I met along the way who were sensitive to some of the challenges that I had. And so, I call those people my angels, because they came in at a time when I really needed it, and I wasn't looking, but it seemed like the person would pop up at the right time, in time, when I needed it, and that still happens to me today. And so in my efforts to get a speaker, I called up and was referred to Mr. Perez, and I told him that I would like to come in and get some information about DVR. And he invited me to his office to have a sit down with him and Diane Sakamoto, and they informed me that rather than me speak on their behalf, that they would need to have somebody come out from their agency to do this. So it was along the way as I was doing my research that I was fortunate enough to get Mr. Albert Perez, like I said, who is the administrator of DVR, to come out and share. And in that meeting, he shared information with me that enlightened me about all the changes that had taken place since I worked for Department of Education back in 2006. I used to get referrals from DVR. I used to get referrals to help clients who had usually high-stress situations going on that were barriers to them meeting their goals. And so they would refer over to me, and I would work with that client on an individual basis and help them to get past those barriers. That doesn't happen anymore. It stopped happening, and I didn't know why, but I was busy doing other things, so I really never looked into it. But in my meeting with Mr. Perez, I was informed that that stopped probably around 2008. And so around that time, I was doing a lot of traveling because I had taken on some other contracts with agencies that required that I go from state to state, or in a couple of cases outside of the country, to work with individuals and families. So it's been on that journey that I have added to my repertoire of skills in terms of what it means to help to put a person's life back together again. The reason I chose this profession is because there were so many broken pieces that needed to be repaired. And so what I found out was that as a vocational rehabilitation counselor, you work with a team. You're not out there by yourself trying to help a person to resolve their problems, but you're working with a staff of doctors, and they have nurses on board that team. You have physical therapists, whatever is required for that person. So instead of having one person try to work with an individual, and I don't know how much that's changed, but this is how it was when I was working as a voc rehab counselor in New York. We had a team of experts who came together to discuss the case of one client. And in doing so, if that person had some kind of psychological problems, then either the case manager or the psychologist would address, what was going on with them from that aspect of their lives. And then if it was a medical problem involved that needed to be considered when we're looking at that person holistically, then the doctor or the nurse would give their input. And I was just fascinated by this field of work because it gave to the client, it gave a team of experts who could address the different areas of their lives that needed fixing. To the staff, myself, a vocational rehabilitation counselor, I talked, listening to what all the other team members' input that they had to contribute. I would take that information and use it to decide whether or not, that person was suited for this type of work or for that type of work. But it was just a fascinating field. And it's always very, very, very important to get to know what the client wants. We have client choice. We have services now that are client driven. And I'm very happy about that, because if in choosing an area of work, the individual does not have a choice in the matter, but they go to an agency that doesn't have any funding, and they say, well, you know, go to the employment office, and the employment office says, okay, here's a job opening at McDonald's, and that person could have high level of functioning, skills to take on a job in the area of their choice, but they don't have the opportunity. So that's a concern for me. I put together, I don't know, I know there's a certain parameter within which the cameras can capture the information up here. And so I put together, well, I call it a vision board. And I outlined some things to help me to stay on point with, you know, stay on target with my talking points. Guess I'm going to need the mic, okay? Now, I didn't get a chance to ask because I know the technicians were setting things up when I came in, but I know this is a teleconference, and so we have the outer islands involved as well. I'd like to know if at this point we could just take a second and ask if there is anyone else on board from any of the
Oh my gosh.
And she's going to be out for a few months. So we're working to replace Marcia. I see Ken back there. Ken, do you know if any of the other islands are on? Oh, you can? Oh, hi. Okay, I turned my head for a minute and then it popped up. Hello, who do we have out there with us today? Can you please let us know who you are and where you're from?
Do we get CEUs for this? I'm sorry? Do we get...
Yes, you do. You get one...
Not that I know of.
For participating, you get 1.5 CEUs.
But I'm not sure if you can work...
Okay, where did you say you're from?
Online.
Ken, please use the mic. I can't hear you.
You do get a you do get a certificate.
We can hear you having a conversation. Hello, can you hear me?
I live in Washoe.
Hello. Hi. For the satellite sites, be sure to fax in a list to me of who attended, and if they want certificates mailed to the center coordinator, and then they can distribute from there. If you don't know the fax number, call my cell phone at 808-221-6204.
And where are you from?
Can each of the sites get on the mic and just tell us where you're from and who's there?
Can you hear us?
We see at least 2 sites on the screen. Can you get on the mic and tell us where you're from? There's actually more, 3 sites now.
Oh, wow. Hello, can you please let us know where you're at, and we'd like to welcome you. Can you hear us?
I can see and hear you.
Okay, and where are you from?
Pearl City.
Pearl City. Okay, thank you.
Yes.
And we have
you.
3 more sites. You're welcome. Who are the other sites? We see 2 more. Can you hear us? Okay, the one waving your hand, who are you and where are you from?
My
Hello?
name is Madeline.
Yes.
Madeline Hiraganuccio. I'm with Kauai Family Guidance Center, and that's where the video conference is located.
Oh, thank you very much. And there's one more we see. There are two women sitting at a table. Yes, hi, you're waving. Who are you and where are you from?
Hilo.
Hilo. Okay, welcome. Thank you very much for being here. So were you able to hear Ken communicate that you do get 1.5 CEUs for participating?
Yes.
Okay. Well, Marcia will be with us until the end of February, so I will make sure that she knows that your sites were here on board with us today, and for participating, you will get 1.5 CEUs. We had some technical difficulties and were unable to put up our PowerPoints. So I have a presentation board here that I'm using, but I want to make sure as I explain this that you're on board with us and can hear me, and if you have questions, need anything pointed out. I don't know how I can put this up so that everyone can see it for the sake of space that I have here and the parameters that I have to stay within in order to, oh, I see it up there now. Okay, let me see if I can get this to show as much of this board as possible. All right. Well, anyway, I'll start with one side of the board. I shared my experiences here as I walked through transitioning from having been a client at the Office of Vocational Rehabilitation in New York, and going on from there when fundings were available to get my bachelor's degree in behavioral and personality psychology, and then they were even willing to pay for my master's degree, but I got a job in the interim, so that's when my funding ended with the Office of Vocational Rehabilitation, which is out here in Hawaii called Department of Vocational Rehabilitation. So I started my own business back in 2006 here in Hawaii, and it's Oahu Counseling Services. So with the skills that I had and the credentialing that I had, that wasn't too much of a challenge for me. And I was still able at that point to use some of my vocational services to help clients who were transitioning from school to work, and also clients transitioning back into the mainstream who had substance abuse problems. So those were the type of referrals that I received from Department of Vocational Rehabilitation early on in my practice before the monies got to be so low that they could no longer contract out services to private agencies in the community. What my intent is to help you to be able to work with clients who don't see outside of the parameters of a 9-to-5 job. I think that most of us, see employment as a routine, traditional 9-to-5, and you work about 40 years, and then you retire, and you get this retirement pay, and it's barely enough. It's about 40% of what you were earning while you were working. So it's really not enough to take care of an individual, unless they have to lower their means of living to a point where they can manage on so little money. But when I first came here, as it says in my story, I was in New York when I was hired for a position at Women's Way in Kaimuki, and I took the position. And I came out here. That was a huge transition for me because I was born and raised and lived in New York all of my life. But I came here for personal reasons, and as a result, I worked at Salvation Army for 6 years, And in the early, I think it was either in 99 or 2000, they had a trainer come in who introduced the staff to a whole new concept based on a book called Who Moved My Cheese. Is anyone familiar with that book, Who Moved My Cheese? Okay. I see some hands up out here. So and on our site in Waianae. Who Moved My Cheese is on this board up here, was a book that we read at Salvation Army Family Treatment Services in order to help the staff to be able to understand how to transition in certain circumstances, under certain circumstances. And it's a great little book. It's very easy to read, and I learned quite a bit from the book about how to organize this, but actually it was almost as though he was telling my story, because I've always been adaptable, and I move with the cheese because I see the handwriting on the wall. In most cases, nothing truly catches me by surprise, and I think if you're living consciously, then nothing will catch you by surprise. But too many people are not living consciously, and that's why I was sharing with Mr. Perez that today I'd like to introduce some non-traditional types of employment that some people may not have considered. And I know that, I don't know how many people foresee what's happening with what's going on online. A lot of businesses are going online, and they're downsizing their agencies to a point where a lot of people are losing their jobs. These are jobs that they were depending on. Even McDonald's. McDonald's in some areas have where you place your order and you speak into the system to tell them, what you want, a hamburger or a soda. Those orders could go to another country, and then it's rerouted back to the person fixing the food, and you never know that you're not speaking to somebody that's in the kitchen or somebody that's right there in the area where you're paying for the money for the food. And that's where the internet has taken us. I mean, it's outsourcing everything that is the norm and what we expect to be able to depend on for employment. I see the writing on the wall, and I'm moving with the cheese. I myself have started a couple of other businesses and online businesses, and so that's the direction that I'm moving in. I love counseling. I still want to be able to provide vocational services. I want to be able to help people to find their niche. I want to be able to help people to learn the skills that are required for them to set their own businesses up online. And that's where my heart and my passion is at now. It's very much related to what I was doing. And so it's nothing that is off my course of my brand or my name and who I am and what I love. It's all, but I'm changing with the times. I'm moving with the cheese. I'm learning the skills. Haven't been right brain in working with people for so many years now, and having to shift to getting into technology and learning how to set up my business online and operate my business online has been a challenge for me, but I'm not going to sit back and let the world pass me by. So this is a choice that I have, and I'm exercising it. So that's what this is about, and I have a picture here. This is home-based business. It's lots of money in home-based businesses. But the reason why we don't have as many people gravitating towards home-based businesses is because they really don't understand it. And the amount of time that I have here today would not do the home-based business justice for me to begin to explain it. But I want to talk about this right here. This is another experience that I had that helped me to see why people don't really get it and can't really conceptualize being entrepreneurs and working from home. And this is a movie that is called, I don't know how many of you have seen it, but it's called What the Bleep Do You Know? Has anyone seen that movie? Oh wow, we have a couple people here. Fascinating movie. Well, I was in Germany when I first saw this. I was on a military base, and off the evening from work, and I went to the library to try to find something to entertain me, and I was captured by the title. When I took it back to my where I was staying and popped it into my DVD player, the movie came on, and it had some really far-out concepts in it. And it was very difficult for me to even believe it, but after I watched it several times. In fact, my time ran out. I had to take it back to the library, and I asked if I couldn't borrow it again because I had only seen half of the movie because there were so many new concepts in this movie. And it helped me to understand why people can't get out of a 9-to-5 job mode and try to go out and take their gifts and talents that they have, and all they need is some support and direction and how to use them, and be able to start their own businesses and do really well. This is $1 million bill here from my vision board at home. This is how I think. I've read the book Think and Grow Rich and Rich Dad Poor Dad, and and I began to exercise my mental muscles and understanding that I don't have to occupy Wall Street to have the money that those people have. The difference between that 1% and me is not opportunity as much as it is knowing how to move with the cheese. I know that things happen. There was a housing bubble that burst, and a lot of people lost their jobs, and there was a lot of downsizing, things that they had no control over. And when something happens like that without you seeing it coming, then it's hard to get up and go again because you've really been crippled financially, and so it's a very difficult situation to deal with. But if you're looking at the way things are today, and you're saying to yourself, well, we have a whole generation Y that spends all day online. We have now, instead of colleges, people considering going out to college, they have college online, so you have to look at what's actually happening in the world to be able to understand that things are changing. The writing is on the wall, as it's mentioned in that book. So I was going to tell you about the movie, What the Bleep Do We Know? And one of the things that fascinated me about that movie was that they showed this picture of the ships coming in to North America, but because the Native Americans had no concept of what a ship looked like, something like that on the water coming into their shores, they couldn't see it. They actually could not see. So I'm like, wait a minute now. What does vision have to do with the mind? But it all works together. The point is, there's opportunity out there, but a lot of people can't see beyond the 9-to-5 job, and they will work 3 jobs in order to pay rent because they can't conceptualize an alternative such as entrepreneurship or non-traditional jobs. But they're there. I myself just recently, and for me it's been like necessity. It's been seeing one door closed that makes me go looking for the other one. And in this delightful little book, Who Moved My Cheese, which I have here, by the way, while I'm pulling it out of my bag, I just want to say that I was so, as I said, impressed by that story. And at the training, they gave us a piece of cheese, and that piece of cheese has sat on my desk until it is now, it's been about 9 or 10 years since that training. So the cheese is vintage, and it went from yellow to a weird color, but it's only because of age. This is my cheese, and it says move with the cheese. So they gave all of the participants in that training one of these little pieces. It's really a stress thing, but if I don't want to squeeze it too much because it's so old, it might fall apart. But this is the book. I had it at home, but I went out and bought another one because the one I had at home didn't look this good, and I didn't think it would be recognizable. So this is the book, and you can buy it anywhere. Any bookstore would have it. It's been a #1 bestseller, and it's now in, I think, over 40 languages. I then, on the back of this, in an effort to prepare for this training and doing my research, I saw in the back where it had Dr. Spencer's, it has a phone number. So I'm like, wow, I wonder if I could contact Dr. Spencer and find out how things are going today, because the book was written in '98. So I called up the number on the back, and I got a company who bought the rights from Dr. Spencer, who are now traveling all over the world to do this presentation on Who Moved My Cheese, to help people to be able to make a paradigm shift in the way they think. And so this is very important when it comes to educating yourself or your clients about change. This little delightful little book, which I think you could read it probably on a 6th or 7th grade level, and it's very easy to read. It's very easy to understand, and it's a fun story. So this is one of the resources that I'd like to share with you today as something that could be very helpful for the clients as well as anybody who wants to understand the changes that are taking place in society today. So that's another of my resources, and having conceptualized all of this, I thought I would go out and test the waters and see for myself, did this work? After studying so much about it, and I did, and I got involved in a business that I'm involved in now, and this is a $10 billion a year business, and it only started in 2002. It's going so well, and it's right in front of the trend because these are people who foresaw which way the cheese was going, and they said they designed this business to be right out there in the forefront, like a Google or a Facebook, to be able to follow the trend, and it's going, for me, it's going quite well. So much so that I thought, and I was speaking with Mr. Perez earlier, and I said, what is the likelihood of me volunteering my time to teach people individually how to do this? I would be willing to do that because I love the work so much in the field of vocational rehabilitation that I would be willing to work pro bono to help people to understand this better. Certainly, if it took me 10 times to watch that movie to understand the concept of how the brain works, that you're unable to shift gears, to change, have a paradigm shift in order to be able to understand how to see things differently and to be able to keep up with the times. That then, it taught me so much about why we have 99% on one side and 1% making all the money on the other side. Well, I certainly have shift gears. I certainly see that ship out there today because of the experiences that I've had, but I didn't see it right away in the beginning. But I can see it out there, and I think that this is the best way to try to explain this to you rather than give you all the technical details about how it works, which is what I've learned through all the trainings that I've gone to on this type of an alternative to 9-to-5 jobs and being an entrepreneur. I understand it now, and I see it. And when I look at the world today, I see it through a totally different lens. I see me and 99% on the other side. Sorry, y'all. But I see myself as being on this side where I've now trained my mind to shift gears and be able to look at the world in such a way that I see that is not just here in Hawaii, but my business can go out to the other 45 countries that this new business that I'm working with operates under. And if it's that simple that it's a matter of shifting gears, changing the way you see things, changing the way you think. Instead of occupying Wall Street, you can put your own talents to work and begin to hone those talents. Get into classes that's going to teach you basics and go from there. I'm talking about referring your clients to classes that are going to teach them the very basics so that they can go from there. Or if you want to change in your own life, then, you know, you get into classes and go from there. And that's how you do it. Because we don't have a middle class, they say anymore. You know, you hear, what's his name, Kiyosaki, as he travels around talking about rich dad, poor dad. He's doing a lot of volunteer work because we have those up here and those down here, and there's no more in the middle that can be able to make it more of a balanced type of system. So I welcome you all to speak with your clients about doing things that are alternatives to doing a 9-to-5 job or working 3 jobs just to pay the rent. That is basically what I wanted to share with you. I had those talking points about how to work with clients, and one of the main things I think is just basics. You know, we have rights and responsibilities that we hand out to clients as they come into programs. And one of the things at the top of the list of rights and responsibilities is to recognize and respect an individual. If we recognize and respect an individual, then we're going to recognize and respect their choices. And we're going to do the best we can. If we are limited in being able to help them to make those choices, then we want to refer them out. We want to refer them to somebody who can help them make those types of choices. Okay? So I want to just leave you with a question before I call up Mr. Perez. And that question is, between a 1 and a 10, how open-minded do you feel you are? Between a 1 and a 10, how open-minded are you in terms of being able to consider grasping other concepts that could be alternatives to the traditional jobs that most people go to on a day-to-day basis, or some don't have a job at all? All right, and with that, I want to thank you for listening. Out there, did you have any questions before we move on to have Mr. Perez come up and talk about the Department of Vocational Rehabilitation? Questions?
I just got here. Let me sit down.
I hear whispering questions. Any questions?
No questions here at Pearl
Yes.
City.
Thank you.
Oh,
we
no
have
questions.
a hand. Thank you very much. We have one hand, but we need the mic so that everybody can hear you. Dolores, do you see a microphone on the table back there? Could you pass it to this young lady here, sitting at 3 people in a row? Thank you. That's the only way the outer sights would be able to hear what you have to say.
I gotta read my question.
Okay.
I was just wondering, you were gonna give us some other alternatives to the basic 9-to-5 jobs.
Yes.
And you mentioned two, which were online jobs and home-based businesses for entrepreneurship.
Yes.
What are some others that we can let our clients know about?
Well, when it comes to alternative jobs, when you look at which way society is moving in terms of not only here in Hawaii, but on a global level, everything is going to be, not everything, but a lot of jobs are going to be based online. So I would recommend you look at that as a future goal for many people who may be considering setting up a business on their own. So just for instance, if I'll take a local job perhaps like fishing. Okay, so if an individual is good at fishing and loves fishing and miss fishing because they can't do it as much as they used to, maybe there are regulations that prevent it or so forth and so on, when here in Hawaii it used to be one of the main sources of income at one time was fishing. If a person still wants to fish and wants to educate others who are losing that skill or talent or vocation to go out and become a fisherman, they can set up a business where they can put the information on how to do a certain thing that they know a lot of other people might be interested in. They can set it up and they can put that business online. It's almost like looking at the ship out there in the water that you can't see, but it can be done. There can be a shift in the way people view how they do things today. And they can set up what they call an e-book, and then they can charge a minimal amount of money. This is a home-based business, so they can charge a minimal amount of money for people to go online, click on their e-book and read it for instructions. They can even take it another level and decide that after they've given instructions, they want to do some hands-on work and take people out and teach them what they know about fishing. So I'm saying taking the culture into consideration, taking the talents into consideration. It's unlimited what you might be able to do.
Thank you.
You're welcome. Any other questions? Okay, if no other questions, then I'm going to invite Mr. Albert Perez to come up.
Hello everyone, my name is Albert Perez, and just want to make a couple of corrections. I am not the administrator for the Division of Vocational Rehabilitation. Joe Cordova is still my boss. I am the Oahu branch administrator. So Oahu is just one of the 6 branches within the division, and Vocational Rehabilitation and Services for the Blind Division sits within the State Department of Human Services. So we are a state agency who provides services to help eligible disabled individuals retain or regain employment. Basically, what I tell folks is that we're an employment agency for persons with disability who's looking for work. To be eligible for our services, the easy part is getting the documentation set that you are a person with a disability. So either a licensed physician, psychologist, or someone licensed to diagnose an individual needs to provide us that type of documentation. Based on that and other pertinent facts, our counselors will then make an assessment as to whether or not that disability prevents them from either getting a job, keeping a job, or learning how to do a job. If they meet at least one of those areas, then they're still in the game. Then the next step would be, do they require our services in order to retain, regain, or learn how to do the job? And if so, then they're eligible. Criteria is fairly simple to meet. If they are a recipient of supplemental security income, or a beneficiary of Social Security disability insurance, then we presume them to be eligible. We don't say they're automatically eligible, although a lot of my staff will say that they are not. But for the most part, at some point in time, these individuals receiving SSI, supplemental security income, or SSDI, Social Security disability insurance, will be found eligible. Now, along with that, our staff needs to determine the severity of disability, and that's an important factor. There's 3 levels. Most significantly disabled, level 1, significantly disabled, level 2, and non-significantly disabled, level 3. And the reason that's critical is that Hawaii, like maybe 26, 27 other states, are in what's called an order of selection. For Hawaii, we entered into the order in October of 2008, basically because we were running low on funding, which is the major reason, or the primary reason, most states will go into an order of selection. Although Voc Rehab is a state agency, roughly 80% of our funds comes from the federal government. So we fall under the 1973 Rehabilitation Act as amended. And what federal law states is that if the state agency, in this case Voc Rehab, is unable to provide services to all individuals, it must provide services to the most significantly disabled individual first. So when we find our people eligible for services, then we will list them in one of those criteria. Back in 2008, all clients coming in the front door were placed onto a wait list once they were found eligible. Then we would service just those individuals in category 1, most significantly disabled. Over time, we were able to eliminate that wait list. We are currently servicing all individuals from category 1, and we are slowly, roughly about 50 individuals a month, taking people off category number 2, which stands at about 760 people on that wait list. Category 3, non-significantly disabled, has roughly, I think, just under 300 people on that wait list. Now that's a significant change for us. Prior to entering into the order, statewide we were servicing, well over 6,000 people. I take that back, well over 8,000 people. Oahu alone was servicing 6,000. So this has really cramped our style in terms of how we deliver services. And business has dropped off. Business meaning the amount of people coming in to receive our services has dropped significantly. Where Oahu was once taking maybe 60 people every week, these are new referrals coming in, we're somewhere maybe down to 15 or 20 a week coming in. The process is fairly simple. You come in, anyone can refer an individual. We provide them an orientation session in which we talk about the services that we provide, talk about the order of selection, and the process for evaluation. If they wish to continue in the process, then they will be given at that meeting an appointment to come back to meet with their assigned counselor for that initial intake session. The counselor has 60 days in accordance with federal law to determine eligibility. And for the most part, we conduct quality assurance evaluations twice a year. And for the most part, the state's doing well in terms of meeting the 60-day deadline. And then they can be serviced, or they are placed onto the wait list if they are in categories 2 or 3. Once they come off the wait list, or in the case of Category 1, they can be immediately served. They will develop what we call the individualized plan for employment, a vocational plan with their counselor, the most critical factor being the selection of the employment outcome or the job goal. This is based on 8 criteria: the client or the participant's strengths, abilities, capabilities, their priorities, concerns, their resources, what are their interests, so they can make what's called an informed choice. The Rehabilitation Act, since 1973, goes through amendments every 5 years. Well, I take that back. It's supposed to go through amendments and review every 5 years. The last amendment being 1998, and since then Congress, I'm not sure what they're thinking to do about us, but in the 93 and the 98 amendments, major changes were made to have the client take more of an active role in the development of their individualized plan for employment. It's no longer the state agency, us, taking the lead on what the participant's going to be doing. The participant has to take a more active lead in the selection of their goal. We can no longer say no. I mean, we can, but that no has to be based on issues related to those 8 factors. What we should be looking at is, if the client has challenges towards achieving an employment goal, what are options that will allow the participant to achieve those goals in maybe a different fashion. So our core services are assessment, counseling, and job placement. Support services, the most popular being training. Many people come to us to receive some sort of training. We actually don't do the training, we just coordinate. And in most cases, we pay for the training. Training can be really simple. It can be on-the-job training, volunteer work experience. We have a very good working relationship with the federal government, in which they will take unpaid workers from us in hopes that they will one day be able to achieve a paid federal position. You can get into, I guess, other types of more formal training, vocational training schools, short-term or long-term, and then also post-secondary training. The law does not allow us to limit the amount of funds necessary for a participant to achieve their job goal or their employment outcome. We have no policy that limits the amount of training a participant requires. What we look at is the employment outcome, the job goal. Then what are all the necessary services this person will need to achieve that job? And we go from there. So the process is pretty simple. You come to us, we figure out what the issues are, what are the barriers, and how we can overcome those barriers through the provision of services that we can provide. With technology, there's so much more people with disabilities can do. That the door, like Angela said, it is pretty much open. You know, you just got to figure out how. You got to figure out where the cheese went. And hopefully we can help our people do that. The issues that got us into the order of selection back in 2008 were for the most part fiscal. We continue to have a large wait list, not because of fiscal issues anymore. We're good. We're solid fiscally. Where we're having some challenges is with personnel. Back in 2009, 2010, there was a RIF, reduction in force. Voc Rehab, like many other agencies, lost a number of positions. Oahu branch, being the largest branch within the division, took a major hit. I no longer have the kind of staff that I used to have back in 2008. And that's why most of the individuals on the wait list are from Oahu. Oahu having the biggest hump. again, because I'm short-staffed. Recently, though, we have been able to fill positions, and that's slow incoming. The people that we've hired recently meaning just within the past two or 3 months, are fairly green. So it's going to take some time for them to get up and start running, so we can start taking more cases off the wait list. The economy is still not as stable as we would like it. My staff is still having difficulties achieving the kinds of successful outcomes that we did in the past. What is good about what we're still doing is the quality of the placements that we're achieving. I had a telephone conference with the federal government. It's our overseers, just on Tuesday, and they were really impressed with our numbers. So not only the number of participants who are able to achieve employment, but it's the kinds of jobs they are getting. One of the areas we look at is participants who are able to achieve 30 hours or more of week work. We have a goal set of $10.69 per hour as a standard. Hawaii is currently at our average successful closure is earning somewhere in the neighborhood of $13.40 an hour. So that includes a wide spectrum. So some individuals are getting a lot of money, and some individuals are receiving minimum wage. But overall, the quality of our rehabilitation closures, our successful closures, looking pretty good. What we need to do is to get more people actively involved in getting back to work, and I think that's possible. We've had a spike, like in the non-disabled population, in terms of the number of people going back into training. When the job market went down, unemployment rate went up, the enrollment in school sort of went up. Well, did the same thing with us. But for the most part, we're fiscally sound. So we're not looking at anywhere near the kinds of chaos that occurred back in 2008. What we're looking at is to try and do more business. Now, one of the things Angela asked that I talk about was not just the order of selection, but self-employment as an employment outcome. The federal law is pretty clear. We don't have a special policy on self-employment. What the feds say about self-employment, and which is written into our policy, that we see self-employment as any other job. Basically, that's it. So just because our participant wants to engage in self-employment, we shouldn't freak out about it or anything. We do have procedures that we need to follow. But for the most part, most people aren't looking at self-employment, but when they do, our staff needs to be ready to address that. And the participant needs to be ready to address some of the questions that we have in terms of their business plan and the development of their business plan and their business needs. So we're the good guys. Yeah, I always thought of VR, and I've been with VR for just close to 29 years. We're dream makers. We make things happen. My wife works for Child Welfare Services, formerly Child Protective Services. I call them the bad guys. I tell you, you guys are the bad guys. We're the good guys. Yeah, we provide hopes and dreams for people to achieve meaningful employment. That's written right into our mission. Mission of the agency is to work as a team so that our participants can achieve their hopes and aspirations for employment. Our previous administrator defined meaningful employment as the kind of jobs you would want your family member to have if he were the client, the kind of job you would want if you were the client. So for some people, yeah, it might mean flipping burgers because that's what they want to do. And for others, well, that's where you get into the dream making. Any questions? Yes? I'll just repeat your question.
Thank you. So Ken made his way over there. My question is, in terms of jobs that you said people might want to do, they go ahead and do them. Is there any means by which to determine if there may be some gifts or talents that that person has that they may be able to use to do something other than flipping burgers? Maybe they haven't even perceived of anything other than that. Because when I was a voc rehab client, I recall the counselor asking me, what do you want to do when you grow up? I was 35 years old. So I said, I want your job. Because if he thought I needed to grow up to, not that I mean it in an arrogant way, but I felt that here was a professional who should have been able to look at the needs that I had and look at the gifts and talents that I had and be able to go from there to direct rather than just say, okay, if I didn't know what was out there, I didn't have knowledge of the resources, and I said, well, I guess all I can do is flip burgers. Mm-hmm. And he said, well, okay, well, here's McDonald's or here's King, whatever. But doing anything in terms of being able to test, because that's what I got into once I became a vocational counselor, was to be able to identify what the gifts, the talents, the hobbies, all of those things that people, I guess, don't even know how to ask for, in a sense. Is there any way in which that's still being done?
It's still being done. It was done years ago. It's being done today. If Joe Cordova, our division administrator, were here, he would tell you his story about growing up blind in New Mexico and meeting with his voc rehab counselor, not knowing what he was going to do, because for the most part, he spent most of his time, or all of his time, in a farming community in New Mexico. And it was through his counselor that guided him on his path towards becoming a counselor, an administrator, and over to Hawaii to be Albert's boss. If Frederick Schroeder were here, Dr. Schroeder is the former commissioner for Rehabilitation Services Administration, the former administrator for rehab services in the state of New Mexico. He will tell you a very similar story, how he did not know, as a person with a visual impairment, what he was going to do. And it was through his counselor who guided him to do more than what he was thinking of. As a counselor, many, many years ago, I primarily worked with recovering alcoholic addicts. And I was sitting with this gentleman, and for the most part, he just wanted to get back to work. You know, like many people, he just wanted money. But in reviewing his employment history, you know, like many people in recovery, they have a lot of work history. You know, a lot of people, you know, would hire my guy. But what was common thread was that a lot of the jobs were below what I considered his abilities. Yeah, he wasn't really going anywhere. He wasn't being challenged. He wasn't being his skills and natural abilities weren't being tapped. So we started talking about, you know, making a different turn. Those opportunities are still there. So although we weren't mandated by law like we are now in terms of looking at the participants' strengths, abilities, capabilities, their priorities, their concerns, their resources, their interests, what's really strong in the Rehab Act today is our people's ability. And when I say our people, I mean our clients' ability to make an informed choice. Yeah. So that way they can take hold of the plan. The most successful vocational plan you're going to get is not one that I'm going to do, but it's one that they're going to do. Yeah, if they come up with a plan, there's a greater chance of it succeeding. Yeah, and it's our counselor who has to take their skill in ensuring how to get over, all the bumps and hurdles. So those things happen. It happens today. And it happened for my boss and his old boss, Dr. Schroeder. Any other questions? Yes, sir.
You mentioned that there are 3 levels of disability. See, I work with homeless clients, and when I work with homeless clients, there's a lot of clients that have disabilities that know nothing about. If our client was a severe mental disability but was able to work, in what category would he be placed? If say like
it takes an assessment to make that call. See, one of the things that the law was clear on was that it's not so much the diagnosis itself, the name of the illness or the disease, or it used to be under the old law. Certain disabilities were automatically this category or that category, but that wasn't fair to people, because not all persons in a wheelchair are the same. Not all persons with a diagnosis of schizophrenia are the same. So, I'm really sorry, but I can't answer the question. Just the fact that your person's working, that's a good thing, but for many people with chronic mental illness, or for many people in recovery, the issue is not as much a problem as getting a job, but it's keeping the job. Yeah, and those kinds of issues will weigh in when we when we measure which criteria they're going to fall into. So I'm sorry, but I can't answer that.
Thank you. I have another question.
Sure.
Does DVR help to fund a PA program for people on DVR? Say, for instance, like the person was schizophrenic but is able to work, just needs someone to be by his side to keep him on track.
Yeah. We don't do long-term. Yeah, we don't do long-term. It's not lifelong services. Our services has to come to an end. But we can provide personal attendant services or a job coach for an individual. Yeah. And I'm looking more at a job coach than a PA, personal attendant. With the job coach, like in many situations, they may require 100%. Or maybe 75%, that the job coach is there on site with the person. Then what the counselor and the job coach should be doing with the employer and the client is somehow developing a plan to wean them off. It's sort of like quitting smoking. Yeah, you take it one step at a time. Yeah, because you don't got to freak out. Want to know that he's supported and that he can do a good job. Yeah. If that's the situation, then the answer to your question is yes, we can. It's not a problem. We've done it before, and we should be continuing to do that, provide that service, but it is not a lifelong service. If it becomes a lifelong service, what you got to do is somehow work it in, where through his benefits, maybe like for example, if he's receiving Social Security, disability insurance, can we do an early impairment-related work expense, So somehow figure out how through his benefits he can host some of his benefits so he can make those payouts to somebody who could come periodically to check with him. Under our supported employment program, what we need to do is to ensure that there is someone who can follow up with a participant for as long as he's on the job. So follow-up means, I believe, it's off the top of my head, so don't quote me, but I believe it's at least 2 on-site visits per month. Yeah. So whoever's providing this service, and if a person has a chronic mental health issue, I would try and work with adult mental health to see if someone from adult mental health will come periodically just to check out to make sure brother's doing okay on the job. And that's possible under supported employment.
Thank you.
You're welcome.
Question for from so that other people know the area?
Sure. I work for Affordable Housing and Homeless Alliance in Kaneohe, right here in Oahu. My question is, I'm originally from California, and I have worked with the Department of Rehabilitation there. Aside from job counseling, I know that the Department of Rehab in California offers transportation assistance and also clothing allowance. Do you offer that here?
Sure we do. I mean, I do training for our new staff. I've done training for like maybe 8-9 years with the new staff. And generally when it comes to the service provision part, I try and generally tell staff what we cannot do. It's a lot easier because that list is small. Almost anything's possible. Almost. Transportation, monthly bus pass, the disabled bus pass, handy vans. Yes, all of those things are possible. Clothing allowance, if a participant is ready to look for work. Interview clothes. Now, his interview clothes might not be the same kind of attire he needs for the job. So, of course, he might need job clothes or a uniform, steel-toe shoes, hard hat. If he's getting into some kind of blue-collar work, he might need assistance with tools. That's just the basics. At one point, when business was really good, back in the mid-90s, the Hawaii Carpenters Union picked up a lot of work. Many things are possible. We won't buy anybody a car as of today. We're trying to figure out how, though. The feds have already told us we have to change our rule. We cannot have a no rule.
Thank you.
Ken Akinaka from Oahu. One of the things we run into quite a bit with people with disabilities is the fear that they would lose their disability benefits if they become employed or self-employed. How do you deal with that?
Okay, so I talked about the assessment that's necessary for eligibility. I also stated that individuals with SSI, Supplemental Security Income, SSDI, Social Security Disability Insurance, for the most part will be found eligible. So early on, at least with the SSI and SSDI folks, the counselor needs to do a financial assessment. Where is the participant at in terms of the monthly benefits, the cash, and in terms of all other benefits they receive, to get a really good understanding what they're looking at down the road. In terms, our goal is to get you off benefits. That's our goal. But it might not be your goal or the client's goal. So somehow we got to work together on that. We have just a few of my staff here on Oahu really sharp on benefits planning. So generally what we're trying to do now through the Centers for Disability Studies up at Manoa is to work out some kind of arrangement where on a fee-for-service basis we'll purchase that. So if we have benefits planner work with our participants so that way they can have a better idea of what's going on with them in terms of their benefits, so that way they can make an informed choice about their employment options, which includes their work hours, salary, and wages. So those things need to be assessed. They need to be assessed from the first day and continue on.
Any other questions?
Oh, good.
Okay, we're about done. So, Angela, say
I'd like to thank everybody for coming today. You get 1.5 CEUs. I want to just also announce that next month we're going to have, thank you. Dr. Palafox is going to be speaking on, Ken, what's his topic?
Pacific Islander special issues.
Okay, Pacific Islander special health issues next month on the third Friday. So our times have changed. days have changed, and we're looking for people to now make that shift and be able to get here on a monthly basis. I was in a meeting this month. Actually, it was actually it was earlier this. Okay, Ken's point me to the podium. As a result of my interest and concern, I wanted to reconnect with the body of vocational rehabilitation professionals in the community. And one of my professional organizations that I've been out of touch with for a while was the National Association of Rehabilitation Counselors. And I went to one of their business meetings this week, and they're gearing up to get back in action to give resources to the community that can help people in need. One of the things I heard at that meeting was that there's a lot of discrimination going on in the community against people with disabilities, that they're not being considered for certain jobs because of their disabilities. And we want to be able to, well, I'm saying we because I think I joined three subcommittees that day, but what I think is necessary to do is to have advocacy in the community for people like this gentleman expressed, the person who is homeless, who has a mental illness. There's a need to have some kind of advocacy of the needs of individuals and staff, because have those special needs. It's so necessary. You know, I know I learned from my own personal experience that I became a self-advocate. Had I not had the strength that I did to do that, I didn't have the supports that usually are necessary to be able to meet those challenges. But I drew on my strengths of just being sick and tired of being denied and sent from one place to the next and not having my needs addressed. I just said, you know, what we really need is to have good vocational rehabilitation counseling. And that's how I set out to choose this as a profession. I saw the need. I saw the need in myself for someone not to just look at me and say, well, this is what you should be doing, or this is who you are. You know, I saw the need for someone to really be in that position, to be able to look at that individual holistically and say, okay, you have this problem here, and you have this one here, so let me send you here, let me send you there, so that when one problem is fixed, another doesn't pop out someplace else. The person's needs are met holistic. And I never regret it, because it's been, for me, one of the most rewarding professions based on experiences that I've had working with individuals who I know for sure would not have been able to move beyond where they were without the help of someone who was really caring. When I went back to work at a community in New York after going to college for 6 years to get my degree in counseling, it was them being able to see that I was able to do it that encouraged a lot of other people to want, to believe that they could make changes in their lives. And I know that when I went back to work for the very same agency that where I'd been treated, that the person who was there in place in that job as vocational rehabilitation counselor had very little hope for the individuals in that community of making any changes. In fact, he was blatant about saying to me that he didn't believe they wanted to make any changes. And that's where my question came. I asked, what do we do if somebody says, well, okay, I'll take this job doing this? Have we looked at their gifts, their talents, their hobbies, you know, all of the strengths that an individual has that says, I can do more than that? Have we taken a look at that to say that this is something that I can help this person to be able to tweak, or to be able to hone This is where the gifts lie. You know, this is what I see in them. This is what they don't see in themselves. So as a result of people looking at the changes that I was able to make through transitioning from one situation to another, it gave them so much inspiration and encouragement that I became quite well known in that community for having made a tremendous difference in the lives of individuals. In fact, I started a business called Project Triumph in New York, and I was given an award by the mayor of New York City for having taken an interest and having set up a program to do the work that was done through that grassroots program that started right there in the center, where they would think, you know, people looking at the people that live there would say they don't want anything. They're not doing anything for themselves. You know, they don't want help. They're lazy. They're this, they're that. They just needed some direction. They needed to know that there were resources, where to find them, how to tap into them. That's what they needed. And I was passionate about it because I think that human beings are the most precious resource on this planet, and that no one should have to fall by the wayside. But, you know, that's my own personal passion, at least, and I think it comes out of my own life experiences. Taught me that with just the desire, I was able to achieve as much as I was able to achieve, just by having the desire, not giving for myself when others attention I have. And with that, I just say again, thank you all for being here, and I'm available. I have some cards and flyers, brochures out on the table. You're welcome to call me at any time. If you have a client who needs some support and they don't know where to go, they don't know about the resources that are available to them in the community, you know, I'm making an effort to learn as I get back into vocational counseling, because I'm a licensed mental health counselor. I'm getting back into vocational counseling because that's my passion. As I'm doing this, I'm learning a lot more. Like as I met Mr. Perez and he shared he shared with me what's going on over there. I'm going around to meet people and ask questions and find out about the resources that are available and make an effort to help those people who just, you know, need that kind of advocacy and support. Thank you.
Angela, thank you. Let's just give her a hand. Thank you. I want to make a quick announcement with Lee to remind that we can get some of the top speakers in the state and sometimes out of the state. If you have a good speaker on a topic that's of interest to counselors, social workers, or even public health issues, let us know. We can probably get also to encourage you, if you have clients that you think might benefit from listening, maybe especially to a motivational speaker, try to bring them with you. We have lots of room over here, and some of the also, but try to bring them. That might be the thing to motivate them to make a change. Don't leave. Can. The other thing is that as of December, all of these sessions are now on the web. They're being taped, so people that miss it can actually see the teacher. And one last thing, the satellite sessions, you're supposed to ask at least one question from the session and participate in that web so that we can continue in the CSAT sequences. So please be sure to decide directly ask these questions, participate, and we'll try to work with other types of CEUs soon to get so available too. Thank you very much, and join us for our new Fridays. I think it's going to be a better day for most people in the long run, and Dr. Neil Palafax is fantastic. He's with the medical school, he's family practice, and he's got most of the studies all through the Pacific, Micronesia, Guam, Saipan. So he's got a lot to say. I've heard him speak 2 times in the last month on different topics. He's excellent. Please join us next month. Aloha. Bye-bye.
Don't forget if you need this pen.
You need what?
Do you need that pen?
Yeah. I need to see Angela too. I need to call her. She plugged me with this. Not in here, baby.